Pharmacist podcast. It is my joy to welcome you to season 5 of this podcast. We are 5 seasons strong, and it is all thanks to you guys. Thank you so much for your support up to this point. Yes, it's second quarter 2025 and it's season 5 of the Anti-Pharmacist podcast. I hope that you continue to support me as always. And today is World Health Day. Yes, every 7th April of every year is earmarked for this day to mark the day the World Health Organization was founded, which is 7th April 1948. And we all know World Health Organization is an organization which is concerned with global health, with public health, with ensuring universal health coverage all over the world. Okay, so each year they choose a theme which speaks to their purpose, the reason for the establishment of this organization. And this year 2025's theme is Healthy Beginnings, Hopeful Futures. This actually focuses on women and children majorly. Actually, it urges the government to increase efforts to end preventable maternal and newborn deaths and prioritize women's long-term health and well-being. That is what this year's theme is all about. The Healthy Beginnings, Hopeful Futures. It's talking about helping our pregnant women, ensuring their health so that they can give birth to healthy babies and so that we can have hopeful futures all over the world. We all know that a nation is as strong as its population, and the more maternal and child deaths that we have, the lesser the population of that country. A very key factor in a nation's strength and development is its birth rate, and if there's increased maternal and child death, then the population will reduce drastically, affecting all other spheres. Okay, it affects the family, it affects productivity and all of that. So this year we're shining the spotlight on caring for pregnant women and newborn babies. Okay, and this can be done by advocating for their care, taking care of women from when they get pregnant till delivery and even after delivery. That also has to do not only with people around but the pregnant woman herself. Okay, as a pregnant woman, you have to ensure your health is topmost to you, because you are not only caring for yourself now, you are caring for your child as well. From taking your prenatal vitamins, from going for your regular antenatal visits, ensuring your child's health and all of that, it's your responsibility as well as the responsibility of people around you. I've made some episodes on this podcast about this. Okay, I've talked about supplements for pregnant women. I've talked about family planning and birth control that also affects women, and it could affect fertility in the long run. I've talked about drug use in pregnancy, the drugs that are safe in pregnancy, the ones that are not so safe, the ones that could lead to fetal abnormalities, the ones you should avoid altogether as a pregnant woman. I have an episode on the topic food is medicine, why you should eat well, to ensure your health and that of your child. I have many good topics for pregnant women that you can access and listen to. Okay, apart from that, I've always talked about how to avoid fake medicines, making sure that you do not self-medicate. Talk to your healthcare provider, especially as a pregnant woman. Do not just go to anybody claiming to be what they are not. Make sure that you talk to a qualified healthcare professional. Visit your antenatal clinics from time to time, okay? And take your prenatal vitamins, your imatinics, they are very important. Your folic acid to prevent spinal bifida, leading to neurological abnormalities in your baby, your iron supplements. Please make sure that you take your routine medication, your sulfadoxine pyrimethamine, which is your intermittent preventive therapy to prevent malaria in pregnancy, which could lead to fetal death, low birth weight, birth complications. Please take all of this, everything as its benefit during pregnancy, okay? And your postnatal vitamins are very important as well to give you the vitality and health you need to nurse your baby in the first few days to months of life. All of these are for your health and for the health of your baby. This is such an auspicious time because right now there is a scheme by the Nigerian government, by the Honorable Minister of Health, Professor Mohammed Ali Pate, for caring for women and children after birth, especially those that have complications. It is called the CMOC program, which is Comprehensive Emergency Obstetrics and Newborn Care. It is for neonates and for their mothers after birth. If there's any complication at all, you're taken care of so that there's no child and maternal death, or it is reduced to the barest minimum. And every woman who has given birth or has complication after birth has access to this. These services are free. They are to ensure your health and that all your healthcare needs are catered for. So this scheme, this care plan is accessible at your healthcare facilities, which is another reason why you should visit these healthcare facilities during delivery. Please do not go to one traditional birth attendant in which if any complication arises, they won't know the next thing to do. Go to an approved healthcare facility where you can access this care. Last time I checked, about 250 healthcare facilities in Nigeria are now fully equipped by the federal government and the Ministry of Health to offer this CMOC care to mothers and their newborns, okay? While another 442 are actually equipped to offer basic emergency obstetrics and neonatal care called BMONC, okay? So majorly any healthcare facility that you visit, a standard registered healthcare facility, as a pregnant woman and as a woman close to delivery should be able to offer you this care. So please take advantage of this care that has been made available to you. The government is making effort, right? So at this point, no woman should die of birth complications or lose their child or children to same. Most times parents are scared when it comes to giving birth, the financial implications of it, the health implications of it, but that should not be the case. The millions of maternal and child deaths we experience every year should no longer be a problem when this policy and care plan is put in place and utilized, okay? So a lot of your healthcare facilities, both primary, secondary, and tertiary, they are under this plan. I talk about this because I am aware that it is being utilized now. You will not pay for a thing. Everything is taken care of. Everything is free of charge just to ensure your health. So please make sure to access this when it is time to give birth. Yes, I'm aware that there have been mother and child centers, mother and child hospitals, maternal and child care centers built in various states by various governments, state governments now in the past, okay? But this CMOC program and BMOC makes those facilities more efficient, more effective. This is why it is very good at this time, not just to have those facilities, but to have the expertise and the equipment to make sure that complications during childbirth are quickly handled to prevent maternal and child mortality. And what's more, at no cost to the pregnant woman or a family. Gone are the days when you should be scared that you have to undergo cesarean section. It's been said over and over again that it doesn't matter how you give birth to your child, either natural or by cesarean section. What matters is that the mother and the child are fine. So if your healthcare provider tells you as a pregnant woman that you have to undergo cesarean section because you cannot give birth naturally, do not fight it. Do not be scared that you're risking your life or you are not woman enough. No, that should not be it. Just accept it, and by God's grace, you have your child, both you and your child healthy. That is the important thing, okay? And for people in the community, let's make sure to encourage, to care for pregnant women, to support them in any way they need, in public transport. When you say pregnant woman, nothing stops you from vacating that seat for her. You're also doing your bit in caring for that woman. to ensure our health and that of our child eventually. I heard recently that in Korea, they are even encouraging people to give birth. So they have made so many plans to make pregnancy and childbirth easy. And a lot of countries are doing this as well. So I believe that a lot of countries are keen into this thing for ensuring maternal and newborn health. Okay, I'm very happy that Nigeria keyed into it, and I pray that it continues, and as many pregnant women and newborns as possible can benefit from it, and it continues that way, so that eventually the ripple effect will show and maternal and child mortality will reduce to the barest minimum. So let's not forget that birth complications are not the only causes of maternal and child death. Okay, child marriage is one of the causes when children start becoming mothers prematurely, when they start giving birth. So please also help in the fight against child marriage, okay, to prevent premature death of these young women and the children they bring to the world. Also ensuring that there is safe water, the environment is clean, so that these pregnant women do not come down with diseases that could affect them and their children. All in all, we just have to join hands with ourselves as communities, with these pregnant women as families, to give our support, and join hands with the government as well. Let's take advantage of what the government has provided within reason, please. And I'm sure that these plans will be sustainable, ensuring that pregnancy is no longer a death sentence for a lot of people, and the birth rate will improve significantly with a great reduction in maternal and child mortality in the long run. Yes, that is basically it for today. That is what I have to tell you. Please do not forget to listen, to share, to like, to subscribe to this podcast on all your podcast hosting channels and also on YouTube. The important thing is to share, to comment, to like, okay, to increase visibility. Also, you can send me mails as usual via antipharmacistpodcast@gmail.com. You can message me via DMs on my various social media platforms, on Facebook, on X, on Instagram, on TikTok. Please continue to support me. I need it. Thank you so much, so much for your support up to this point and for your continued support going forward. I'll see you next time. Till then, stay healthy and God bless you. Bye.